Hello, and welcome to Health Affairs from A to Z. I'm Nancy Valentine, PhD and registered nurse, and I'm a clinical professor at the College of Nursing at the University of Illinois at Chicago. And I'm inviting back our sparkling guest from last week for a second part in the series on mood disorders. So Dr. Julie Carbray is with us again. Now, last time talked about mood disorders in children and in teens, and today our show is focused on how to get help and some of the tips of what you can expect in getting help for your teen or child. This is really always a very, very tough road for people to embark on. It's hard enough to really come to the realization that your child needs some help and some guidance, which was the focus of our last program, how to really see those signs and symptoms, and Julie is going to go through some of that to recap it for you briefly. But then it was, how do you then move to that next step, and that is how to get help. So we're going to talk specifically about that. She has some case studies from her own practice that she can draw upon, and we're going to give you some tips as you go embarking on that journey to get the best treatment for your child or your teen. So again, let me introduce Dr. Julie Carbray, who is also a nurse with a PhD degree, and she is a professor both in the College of Medicine, in the Department of Psychiatry. She runs the juvenile program there, and they do a wonderful job in treatment, so she has some opportunities to tell you about some of her work. And then she is also on faculty at the College of Nursing. So Julie, it's just great to have you back.
Thanks,
again.
Nancy.
I'm so thrilled to hear more about this topic, because children and mood disorders is common, as you pointed out. Sometimes you don't know if it's just a developmental step or if this is a real problem. So tell us really briefly again, sort of what are some of those cardinal signs and symptoms that people can really focus in on. And before she goes into that, I just want to remind you, the viewers, that this is a call-in show, and you have an opportunity to ask an expert with Julie. So please join us with your questions. So again, tell us what some of those signs and symptoms are.
So what we talked about last time was that most kids will go through a time where they may be more sad, or they may sleep more, their appetite may change, maybe they're a little more cranky than they typically are. But we're really talking about symptoms that stick for more than a week, 2 weeks at a time, and really show a marked change in the child's behavior. So you'll see more moodiness, of course. You may see disrupted sleep. You may see a change in appetite, more conflicts, possibly withdrawing into themselves, not giving quite as much of that personality that the child typically shows. And usually as parents, you begin to have some intuition something's going on.
Right.
When we talk about a mood disorder, it's really going on for more than a couple of weeks' time, and it really begins to impair the child's functioning.
Right, and I think that's really a good tip right there. If you think there's something wrong, there probably is something wrong. And we also talked about how other people may come to you, friends, neighbors, other family members, or teachers. So you really have to be alert to that, and you have to be opening to listening to their feedback and not being defensive of your child, but really understanding that people do want to be helpful. So with that being said, what are then the next steps that we can talk about today?
So we talked about this briefly last time, probably starting out with a healthcare provider, the nurse practitioner that your child typically sees, or your family practitioner, and just really beginning to explore, is this more than just typical moodiness? If indeed that is the case, oftentimes the pediatric nurse practitioner or primary care provider might suggest that you see a specialist, somebody that specializes more in the treatment of mood disorders for kids. And that will typically be either a psychiatric nurse practitioner, a psychiatrist, a psychologist, a social worker, a counselor. There's a broad array of disciplines that are really involved in treating kids. But you want to make sure that you see a provider that really knows kids and can speak with kids.
Right. So I think what she's saying is that you can start with the people that you know. So if you go to a nurse practitioner or you have a family doctor, that is a very good, first place to seek some guidance, because you really want to validate with them what you're seeing and your observations. So if you have a chance to talk over your observations with someone that you know and trust, then that is really good. But when you go then to the step of, if we're going to get treatment for my child, my teen, then they are probably not going to be the treatment team. They are going to refer you to other people that have this as a specialty? Does it matter if you have different kinds of insurance? I mean, what kind of a provider you're going to get, who's a specialist in this area?
You know, it really can, and that unfortunately is tends to be one of the obstacles towards getting care for kids. There are really some workforce issues. There aren't a lot of folks that specialize in children, so starting out with a primary care provider, nurse practitioner as a beginning step and sort of being held there until you can get the best service, which oftentimes can be dictated by insurance. Some insurance companies will give you a whole array of choices, and others may be limiting. So then again, asking your primary care provider, your nurse practitioner, who might you suggest?
Right.
What if families told you in the past
Right.
might be special about this provider?
That's a good tip right there. You know, they may know people that they've used and they trust, and they're going to refer you as well. For anyone that's listening that's thinking about a career choice, often people don't even think about child psychiatry or psychiatric nurses that specialize with children, or psychologists, and there really is a huge gap of people that have that special expertise. So that only makes it harder to find those folks when you really need them. So if you're thinking about some choices of your career track, that may be one to consider. That's a whole other discussion in itself.
Right,
We
right.
could do another show on that topic.
Yes, yeah.
Okay, so lead us down to what we need to really pay attention to.
So when you're looking for good treatment for your child or for your adolescent, you really want to be very tuned into the specific symptoms of your child's mood disorder.
Okay.
And best treatments actually address those components of the mood disorder. And so there's a nice body of literature, of research that shows if you really have targeted treatment for your child that's in a child-friendly environment, usually mental health care providers who specialize in children and adolescents are very comfortable in getting kids to talk.
Oh, good.
Just really helping to sort of pull out some of what may be going on, and then also helping the family to be a part of the care, because the child is an important part of the family, of course.
Absolutely.
Yeah.
Well, I think getting your child to talk to someone else is a huge step right there, because often they won't talk at home, and that's one of the symptoms
Right.
that really is an alert to you that there's something seriously wrong.
Right.
Do you want to go through some of those steps
Yeah.
and signs and symptoms?
Yeah.
Well, let's share that with our viewers. Okay, so walk us through this.
So usually what we're trying to do when you have good evidence-based treatment, and that's really treatment that is supported by research, is you really want to intervene early to identify what the core symptoms are for the child, and to just help the family to accept that this is beyond what is typical for the child, and to accept that there's something larger than the child's ability to handle that has now really affected their ability to be themselves. So we want to help them to accept the illness, and then also to begin to buy into the idea that therapy, and in some cases medication, may also be part of the solution. And we'll talk about components of good therapy and good medication treatment in just a bit. But the bottom line for effective psychotherapy treatment is really being able to help the child to be able to cope with stressors that are going on, especially those that are associated with their symptoms of sadness, irritability, to stabilize some of their sleep and wake patterns, which typically will bring kids into treatment, to get them back to being a good friend, being a good student, re-engaging with the family, and then to build up the family. And of course, early treatment, we talked about this last time, can really help decrease the risk of substance use or delinquent behaviors or high-risk behaviors. So it's really important that early treatment happens for kids.
Right. So looking at this list again, this is a tall order. I mean, they may look so simple when you read them,
Right.
but they're really not. They're not simple. And some of this would take some time to really accomplish.
It really does. And so that's something that families should really know, is that as you begin to help your child with a mood disorder or depression or bipolar disorder, there's going to be a process. So you're going to start out first by really examining the symptoms, then addressing the symptoms, helping the child individually, and then also helping the family with all of these type of goals. So it will take a little bit of time. There are some cases where you see some fast results, and more often than not, it's gradual, with each week getting better.
Right. I would think that some of the items here, like increased acceptance of the illness. Is that hard for a lot of kids to master just that step alone?
And Nancy, I think that's very hard. I think there's still a lot of stigma around having a mental illness, even calling something a mental illness.
Mm-hmm.
So I think that acceptance can be very important, and it's really the gateway to that child or that adolescent being able to just step in and begin to take care of themselves.
Right, right. How about when it comes to, I see on your list you have enhance the compliance. Concordance is a big word, but really being able to take medication and engage in therapy. What are some of the strategies that you use to help children get over that hurdle?
Yeah, so if the child or adolescent sees the medication as being helpful, then it's easier. But if they see it as something that might change themselves, or they have some ideas of the medication causing them to be somebody different than they are, that's something that we have to take care of in the therapy part of prescribing medication. The other thing, too, is really exploring their acceptance of the illness, giving some terms to it. So that's an important tip as well, is if the child calls it, this is my wiggles, I just wiggle a lot because I feel I always have to move, then we use wiggles when we talk about it. And that's really important to convey to the child, I understand what you're trying to tell me. And that helps them, too, if you're a mental health practitioner, it really can speak to those words as well.
Okay. How long does it take to help people stabilize their sleep and other daily routines?
Well, if you think about it, we all struggle with that. We know that routines are helpful for us, but there are times when we're up against deadlines, or if kids have projects, there's going to be some flexing with that. And so it is something that we set as a goal. We talk about what's realistic, and we begin to move towards that. Again, you see great response if it can happen quickly.
Right.
But we're talking about changing behavior, which sometimes can be slow.
Right.
And so it really depends upon the kid. I've had some kids who I meet with on one visit, and we draft what might work with them, with their behavior, with taking a look at their thinking patterns, and by the next visit they say, I'm using these skills and wow, does it help? And then other kids where it's slower.
Right, right. So everyone's an individual, and
Right.
so there isn't any like one-stop shop on how to do this. How about the kinds of therapies that you use? I mean, what you're talking about sounds a lot like one-on-one, like a therapist with a child, and then maybe moving to the family. Tell us about how some of this works. And we have another overhead. We're going to list out some of these things for you.
I just wanted to make you comfortable with some of the names for therapies. Group therapy can be commonly used, especially with teenagers. Teenagers like to talk to each other, and so sometimes having a group format for working on depression. We have such a group at IJR or here within the Department of Psychiatry, because some kids really like to connect with other kids around managing their moods.
Tell us again what IJR is.
It's the Institute for Juvenile Research.
Okay, at
Yeah.
U.I.C.
At U.I.C.
Okay, thank you.
And then cognitive behavioral therapy is really the gold standard of therapy that can really help kids with mood disorders, whether it be bipolar all the way through a major depressive disorder. And that really helps you to examine your cognitions, the way you think, some of the behaviors that you have, like sleep and eating, and how you're regulating those behaviors. And so we'll talk more about that in the next slide. Interpersonal psychotherapy helps kids to really understand their relationships with others and how they get what they need from those relationships, roles they may have within those relationships. Family therapy is critical when you're talking about treating children and adolescents because, as we talked about before, the whole family is a part of treatment.
Right.
So it is more rare that you will only meet with a child or adolescent than also including the family in visits.
Right. Now let's talk about that for a second. Is it because the family is part of the problem, so to speak, quote unquote, or is it more educational to really help the family understand what's going on with their child?
Nancy, I think it's really both.
Okay.
It's a real combination, and it really depends upon the family. There are some families where when I first meet with them for the first time, it's very clear that the child views their environment in very different ways than the parent. And so our role as a therapist is to try to bring those two worlds together and then problem solve. And then there are other families where everybody sees the problem the same way, but we just need some skills. We need to know what to do with it. And so then there's some time spent alone with the child building those skills, and then some time with the family on how can I support them in building those skills.
Right, right, okay. So that covers family therapy. How about psychoeducation?
Psychoeducation is really teaching about the illness, about illness management strategies. That's across the board, should always be a part of what you talk about with your mental health care provider. And then dialectical behavioral therapy is more specialized, and this is a therapy that really takes a look more at how the child might be able to take on stress and walk through stresses without really reacting to those stresses. So there's a lot of nice literature saying that this can be a supportive type of therapy. There's a lot of self-help materials out there. There's books, there's websites, and as a parent you want to make sure that you pass those by your mental health care provider just to make sure that they also agree with whatever is being said on the website, because you want to be a good consumer about what's out there. And then lastly, there are medications that we typically will start with children who have mood disorders.
Well, that's a lot. Now, do you have to go to a different therapist for all these, or do they roll up into one?
Well, ideally that would be great if they all roll up into one, but sometimes there's more of a team approach where you will see somebody for the family piece, somebody else for the individual piece, maybe someone else for medication. But there are some clinicians who can do a little bit of both, and it depends upon that clinician.
Right.
Yeah.
So one of the tips is to find out for your child what kind of best therapist to start with, what style and type of therapy do they use, and can they organize individual with family, or would there be somebody else that would do the family? So you as a wise consumer can ask some of those questions right up front.
Right.
Let's move to the thinking styles. This is very interesting in terms of how you work with people around thinking styles, and let's see if we can make this a little larger for a few
might need to
viewers.
be a little bigger. Just a couple of examples. These are some techniques or some ways that we help examine cognition, or the way that kids can think about their environment or what comes into their environment.
Okay, so people can have some shot at reading this. Start on the left.
So some examples of what can happen in a mood disorder is you have all or nothing thinking. Everything is good or everything is bad. And what we try to do is help the child become more flexible in interpreting what's happening in their environment. A mental filter is, again, screening everything through the depressive lens. So rather than, maybe an example would be that a kid is walking through the hallways and somebody says something about their clothing. Hey, I like your shirt. And instead of taking it as, I like your shirt, if you have depression, you may think, he's being really critical of me. He doesn't like my shirt. But that shows that filter of that depression.
Of everything negative.
Exactly.
Right.
Exactly. And then again, it might be difficult to go through all of these for time's sake.
Let's do a couple more then.
Yeah. So I like this disqualifying the positive. If positive things happen, you might, again, just sort of say, well, that can't really happen. Nothing good happens to me. Words like should and must sometimes make us feel guilty if things have to be a certain way. Again, we're talking about flexibility of thinking. And then blaming yourself for everything. It's all my fault. Something's wrong with me. Everything goes badly. So what we try to do is we might give a list of these examples, or give a couple of these examples to the child and say, do you sometimes have thoughts like this? If the child's younger, we might say some kids have thinking patterns that always tend to be negative or always make them feel badly. We call it stinkin' thinking or stinkin' thinking, thoughts that stink, rather than help them feel better or more positive.
Well, I think this is really a good chart because it really categorizes different types of thinking.
Yeah.
So that it gives it a label. So everything isn't just one big mush of negativity. You're able to really break it down. And by breaking it down, you can give prompts to the child as part of the therapeutic process of how to reverse that, correct?
Exactly. And so we might use a cartoon, and we might have a face of a child with one bubble. That might be the thought that's very negative. And then ask them, how could you have seen this differently? If depression wasn't a part of the piece, what might that look like?
Right. Now, we did talk about medications, and people are always extremely curious about medications. And so oh dear, this is obviously I have to master the Zoom technique here. Okay, so here are a list of medications for children and adolescents with mood disorders. So can you just give us a brief overview? Because some of these terms people may or may not have heard of. And I see you've got some FDA approved and some that are not FDA approved. So tell us the difference.
So this list is really for children who have mood disorders, including mostly depressive disorders. If we were to go beyond that to bipolar disorders, that's a whole nother ball of wax. But for these are the most commonly used medications that kids can use to help improve their depressive symptoms. They should not change a child, but they should change those core symptoms of sadness, withdrawal, sleep dysregulation. And you'll see that the asterisks are next to those that are FDA approved. One of the challenges you have with children and treating children is that our research is still catching up with our clinical needs.
Right.
So we're still waiting on FDA approval for some of these medications. But the gold standards where most practices will start, because there's the most evidence supporting their usefulness in children and adolescents, are medications like Prozac, which is also called fluoxetine, or Zoloft, which is also called sertraline. So most clinicians will start with one of those two medications because there is the most literature out supporting their use. The newer one is Lexapro or Celexa. It's a newer Celexa.
Lexapro or Celexa.
Celexa, which is right above it. And so you'll see a lot of that being a first-round treatment for children who have depressive illnesses.
Okay, well, that's a list. So some of these, if you're involved with therapy for your child, you may know about some of this already, but this is the list. So it's not just one or two. There are options.
Exactly.
And sometimes a therapist will start with one. If they're not getting the effect, they can move to some others. It's very much of a customized approach, like it is with any medication regime for most illnesses. You usually have to do a little bit of experimentation with the chemistry of it all, right?
Right, and that's one of the things that's very different than other areas of pediatrics. If your child has an ear infection, you pretty much know that medication is going to affect your child's ear infection and they'll get better. But when we're talking about mental health or psychiatry, sometimes we have to try a low dose and then we go very carefully, and if that medication is not effective because of its makeup and your child's makeup, we may have to try something else. And that can be frustrating sometimes for families, but it really does help if the family's educated about their medication choices, about medication, so that when they come in they can ask their clinician about questions about expected effects, as well as the child, so that everybody's on the same page.
Right. Well, in our concluding few moments, I think people like to know not just the abstract in terms of, this is what we do and this is how we go about doing it and these are the different categories of illness, but people like to know, does it really work? So can you give us some works in this institute with juveniles? And can you give us some ideas of things that you have seen work and what the outcomes look like?
Yeah, it's very hard for families to get to the point where they finally get to treatment. But boy, 80% of the time, our literature shows that anywhere from 80 to 90% of the time, if your child gets into treatment.
Statistic right there. Sounds really good. And we have a caller, so let's listen to our caller's question.
Hello. What you've been discussing, and one of the critiques I've always heard about medicating children is that they are far too young to be medicated, or the diagnoses aren't really real, and all they need is a timeout or a spanking or some other manner of discipline, and that would be better. What do you say to those sorts of critiques?
Well, let me just say one thing before Dr. Carbray. We talked in our last show, and you can access this on the CAN TV web channel, that there are differences between just an episode for which some intervention, like you mentioned, may be possible to just sort of calm a child down. But we're talking about long-term implications for which those interventions are simply not going to work. So your real question, though, is about medication.
Right, and the gold standard for treatment with kids is really to start with therapy. And things like timeouts or how can the parent really help that child can be effective. But it's when those behavioral techniques really go without good results that then we have to move towards more effective treatments. And in my experience as a clinician, almost 30 years now, medications and therapy can really help change the lives of kids. And these are kids who always have that negative functioning on their lives because of their illness. They're chronically sad, they're withdrawn, they're not going to school. So we're really talking about that level of symptoms, and then medication can really be a helpful tool.
I think one of the things to keep in mind is not that the child is too young or medication is bad for them. They have to get to the right person and get the right medication. I mean, to be on the wrong medication for any period of time isn't going to help anyone. So that, I think, it's better to really explore and look at all of your options rather than just sort of take that like it's not a good idea right off the bat kind of idea. We don't have much more time, so we're going to have to wrap up today, but you can see there's a whole world of opportunity here to really discuss this kind of topic in more detail, and we'll have to have Dr. Carbray back again and tell us more about some of her clinical examples, because that's where the rubber hits the road. Thank you so much for joining us. Have a wonderful day.